Okay, so we have seated our patient and we have our armamentarium ready. It consists of mixing bowls, alginate mixing spatula, alginate material itself, appropriately sized trays, measuring cylinder, scissors, mirrors, goggles, and the bib which we've set on the patient. So we come in first and we try in the tray, maxillary first. We want to see if the tray fits properly. We want to see if it extends all the way back to the soft palate and there's enough room on the buccal aspects, leaving about 4 to 6 millimeters between the tooth and the inner part of the impression tray, and also that it extends all the way up to the vestibule. We do the same thing for the lower trays. Ask the patient to stick their tongue up to their palate and make sure that they're comfortable and they experience no pain while doing so. Now we're getting ready to mix the impression material. We're using fast set alginate, typically 2 packets per arch. We use the upper part of the bag as a measuring cup for water. Once we've poured the powder in 1 alginate mixing bowl, we need 2 waters. Poured in a separate bowl. And we always add powder to water. Slowly add the powder and we mix as we do so. And we need to keep in mind that the material sets very quickly, therefore we need to mix it very fast, as quickly as we can. And the color of the material changes as it sets, going from purple to pink while it's setting to white while it's completely set. So we load the material in the tray and make sure there are no air bubbles in it. We do this as fast as we can. Ask the patient to open widely, breathe through their nose, have their chin down to prevent them from gagging, and gently push the tray up while holding it with 2 fingers. Ask the patient to keep their mouth wide open. And keep holding the tray in while we're waiting for it to set. We do not put more pressure on the tray at this point. We can look at the color to see what color it is, and if it has turned white, that means that the material has set fully and it's time to take the impression out. Very nice impressions. You can do the same thing now for taking the impression on the mandible. Once again, quickly mix the material. while we turn the bowl. Set the material in the tray, not overfilling. Once again, ask the patient to open wide. Seat the impression, make sure it is extended all the way to the vestibule, and ask the patient to raise their tongue up to their palate. We continue to hold the tray in with our fingers. Once again, we can check and see if the material has set by observing its color.
Yep.
And we gently pull the impression tray out. Another beautiful impression.